Welcome to the NEJM Outbreaks Update. I'm Stephen Morrissey, Executive Managing Editor of the Journal, and I'm talking with Eric Rubin, Editor-in-Chief, and Lindsay Baden, Deputy Editor. Today we're joined by Dr. Lindsay Weaver, the Indiana Commissioner of Public Health. Before taking that position in 2023, Lindsay was the Chief Medical Officer in the department. She's trained both in emergency medicine and in palliative care, so she brings an interesting perspective to her role as a public health leader. But before we start, Eric, can you summarize what we've learned about the H5N1 outbreak in our previous discussions?
Steve, we've had a couple of conversations. First about the virology of disease of H5N1 and the populations, largely animal populations in which it exists. And then a second discussion about public health approaches to the H5N1 epidemic and how things are being implemented in different ways in different places.
And then turning to you, Lindsay, let's start by talking about the state of the H5N1 outbreak in Indiana. Have you seen any human infections?
We have not seen any human infections in Indiana. We have had people with known exposures, both occupational, backyard flocks, people finding sick birds and caring for them. So we have monitored people with exposures, offered testing, even tested in some cases, but no known cases of humans in Indiana.
And then what's the situation more broadly in the animal population? Are there infected cattle? Are you finding the virus in wild birds?
We're definitely finding it in wild birds. We've only had 113 since 2022 that were laboratory confirmed, but we know of more wild birds than that, just, based on finding, unfortunately, these dead birds in people's backyards and on farms, et cetera. Really, our Department of Natural Resources focuses on testing the wild birds in new areas where we haven't seen birds infected with H5N1 before in the past. So it is broader than that. That's not a great number. We do also know of poultry. So our poultry farms have been affected pretty extensively, and no cattle that we know of to date, and no other mammals. Like I know other states have had cats, et cetera. We haven't had any of those test positive at this point.
Lindsay, you brought up cats, and I know that there have been infections, particularly among farm cats who have access to domestic cattle and domestic poultry. They're usually a pretty good indicator because they get quite ill, so you haven't seen an increase in deaths among cats.
Yeah, so we're really lucky. Our Board of Animal Health, our Department of Natural Resources, our local health departments, and here at the Department of Health work really well and collaboratively with each other. The Board of Animal Health has worked to form relationships with the poultry farms, the cattle farms, the dairy farms across the state to communicate. So there is that open line of communication if they see anything. But to my knowledge, that hasn't been reported.
Looking more closely at that surveillance, what's Indiana's approach been to looking for H5N1 infections in domestic and wild animals?
So on the domestic side, we are working with the USDA now to test our dairy milk. And again, no positives in our dairy milk in Indiana. And then the Board of Animal Health is working with our affected poultry farms. And we do know over 7 million birds were affected in 2025, and several pretty large commercial farms and then some backyard flocks as well have been affected this year. So that surveillance is ongoing. And like I said, the Department of Natural Resources is the one that is in charge of testing the wild birds. And they do that when it's in a new area or there's some question around that. I think that's kind of been one of the frustrations from the general public is that they find these dead birds on their front porch in some circumstances. And then they have an expectation that someone's going to swoop in and take the bird and go get it tested. But there's just really not the capacity to that. So it is communicating, what do they do? How do they report it? They, still ask that people report it. And then how do they manage those animals safely to protect themselves? So that's been a big part of our conversation.
The animal side of this is not something perhaps that you thought about when you took the job as a Commissioner of Public Health, but it is pretty important. Do you know, are there restrictions on moving cattle across state lines, given that Indiana hasn't had infections that have been recognized yet? And how about moving birds?
So those are really good questions. I don't want to misspeak about, but I do know a couple of our neighboring states have had affected cattle and also affected birds. So I know that there were some restrictions in place, but I don't want to misspeak about that. And you're right. I mean, it was not something that was on my radar when I came in and took this job, coming from working as an emergency medicine physician and really in the healthcare sector. But through the last 5 years that I've been here, even through the pandemic, it was really important that we were working closely with our partners. We do have a state vet that's here at the Department of Health and is helping keep us updated and helping with those lines of communication. So we're really lucky that we have that collaborative spirit.
So, Lindsay, you mentioned that 113 birds have had H5N1 identified. Are these sequenced, and do we know if there's an ongoing spread, or what have we learned from that if that's been pursued?
So those are the laboratory confirmed. Again, we believe that there are more, and those have been sequenced. And we do keep a map where people are reporting that they find them on our website, so people can see that it is broader and goes further than those 113 boards. Because again, that was since 2022. And really in 25, only 11 of the laboratory confirmed. But we are, because of the poultry flocks and our commercial flocks, we know that there were more.
Over the last few weeks, I've heard much less about H5N1 across the country. Is it your sense in Indiana that it is slowing down? Perhaps there's saturation of the reservoirs, or is there changes in how we do surveillance to understand the ongoing spread and what that might look like?
So yes, we do believe that there is less of it now. We also know that we see it higher in fall and spring with the migratory effects of that. Many of the birds that we were seeing earlier were the migratory birds that were getting sick. So I agree with you that we are seeing less of it. And, as I also mentioned, we are just now testing the dairy milk and are glad to see that our dairy cattle to this point have not been affected.
And are the flocks being repopulated then, which may have important economic implications for the summer and fall?
Yeah, it's really important for our Board of Animal Health is working really closely with those farms. And again, there's a lot of trust, effort. There's a huge undertaking to be able to address when they depopulate and then what is the time frame and the process by which they get to repopulate. And so they're working hand in hand to do that process because that is an economic burden on that farmer, on the owner of the poultry farm, and then also for the community at large.
Lindsay, as an emergency medicine physician, what's your thinking when a patient comes into the ED with flu-like symptoms? Do the rare cases of transmission, including, I guess, none in Indiana, to humans affect your management of such patients?
This is something I think about and have talked to my team a lot about in this space, but in others as well. It was a surprise to me when I came onto this role that we don't have a great way of getting communication out to clinicians. I don't have a one email list, a one stakeholder that can reach all of the clinicians across the state to say, hey, consider this when you're seeing a patient, right? Ask the right questions. You happen to work on a poultry farm. We have had some exposures, and those individuals have shown up to the emergency department with symptoms. They did not have H5N1, as I mentioned. And thankfully, they knew to mention that they were working, depopulating, or on an affected poultry farm, right? But it wasn't, in those instances, it wasn't the clinician asking those questions. So I think it was a good reminder, too. It's twofold. So we've been working a lot on that and just what are the different avenues by which that we can reach clinicians. And again, this is not just H5N1, right? This is also, with measles, talking to my epidemiologist, I had to remind them the vast majority of clinicians in the state have never seen measles, right? They learned about it in medical school or in nursing school one time. And it is our role in public health to get that information out there and be like, this is what you're looking for. This is what you do, right? Same with H5N1. Ask these questions because it will change your management of that patient compared if it was just, normal influenza A. And so we've been working on different avenues. We, of course, work with our associations to get out that messaging through our hospitals and our primary care networks. But we also know it doesn't reach everybody. So we're working on a podcast to see if that would be a good way to connect people. We have actually limited our health alert network notifications because, when I came in, they were coming too often. And so people weren't paying attention to them anymore. And so we actually minimized that so that when we send out something, it is hey, this is really important. You need to read it. We also condensed it into bullet form so people can read it really quickly, asking our infection prevention people to make sure that they share that with their clinicians. So we're still working through that, haven't figured out a solution, but it's something I think about a lot because honestly, as an ER doc, it is not one of my questions when I have someone in the middle of flu season come in with flu symptoms, right? You're going to anchor immediately onto what's most common. And especially if you've never seen it before, and I work in an urban area, so it wouldn't come to mind, but some of these people have presented to urban areas. So we know that everybody should be thinking and talking about it.
Lindsay, I wanted to pick up on the theme of communication because you have two different audiences. You have clinicians, as you said, who you're reaching out to, but you also have the general public who can know when to go to the hospital or what they should be avoiding or what vaccines should they be getting. So how do you approach communications over public health issues?
We've found a lot of good outcomes from that localized messaging through our local health departments. So we are decentralized. All of my 95 health departments in Indiana are completely independent from the Department of Health. And of course, we're here to help support and provide guidance, but they know their communities. They know the worries, the concerns, what the population is, what the resources are. Do they have a hospital? Do they not have a hospital? And we learned many of those lessons during the pandemic to lean on them to get the messaging out in the right way. They have very popular Facebook groups, or they know the group of individuals that can get out the messaging to their community. And so we've learned to rely on them, including in this case. So where we knew we were having issues with wild birds and also the poultry farms, it was really our local health departments, and through support and us, we helped provide them talking points about how do you get out that messaging, right? To leave the sick bird alone, because that would increase your risk for exposure. This is what you do if you find a bird that is dead, how you can get rid of it and what that looks like, connecting them to the DNR resources and making sure that anything that DNR, the Board of Animal Health, or we as the Department of Health put out and them, that we're all saying the same thing and linking back to one another. So no matter where somebody went, they could find the information that they were looking for.
Well, one group of the general public that has been difficult to reach in some states has been farm workers themselves who are at particular risk. How's that going in Indiana?
I think, again, you have to rely on those relationships, and why I'm happy that our Board of Animal Health is working with the vets across the state who work specifically with these animal populations. I know that was especially a big deal in communicating with our dairy farm workers, and they have very specific veterinarians. But the pre-established relationship, it's the same with our farmers who are doing produce, right? That if there is a concern around any foodborne illness or whatever, that you have to have that pre-formed relationship, that trust, so that you can work through the issue together from the public health side and also from the business side, right? We want to support these local producers and make sure that they're successful so that they understand that it is a collaborative effort and we do want everybody to have success and we want people to be healthy. So it is the work really on the front end that is helping us in the middle of, some potential. It's terrible when they have to depopulate their entire poultry population. They have to trust that their state partner is going to help them through it. And federal partners too, right, are also at the table.
A clarification, then I have a question. DNR, what does that stand for? Usually that's when we don't resuscitate.
Yeah, sorry. I thought the same thing. It is our Department of Natural Resources.
Thank you.
Yes, sorry. All the acronyms.
Trust me, we got ours. So, Lindsay, you were just talking about how to get the word out to the community. Are you getting the word in from the community? And I'm thinking in terms of the surveillance tools that you have to understand what's going on in the animal population, the surveillance tools you have for what's going on in the community population. As you said, during flu season, if somebody comes in with flu symptoms, you anchor on that. What tools do you wish you had or could be augmented that could make your input in more valuable and allow you to be more effective?
I do think surveillance is important, and we do have a flu surveillance across the state where our partners submit specimens to us to do the testing. So we're looking for things out in the community, and definitely if it was out there, you could find it in that way. We know that things can be located in specific geographic areas, so making sure we have a little bit more broader reach in that will be important moving into the future.
Can we help advocate for the more resources you need to be more effective?
I again just have to say that I appreciate these locally driven decisions that we as a state, that our local hospital systems, our local health departments, are really working well together to figure it out what our needs are within the resources and how we work together. It was something else I figured out throughout the pandemic, that every state is a little bit different. We were really thankful that our hospitals worked really well together and with us to make sure that we were looking at the state as a whole and how can we take care of the state as a whole. So I think, continuing to lean in on that and advocating the ability to be able to do that is also, something that we need to think about and focus on.
Lindsay, what resources are available to physicians in Indiana who think they might be seeing a potential H5N1 case?
We want them to call us so we can talk them through it, right? What is the right specimens to get? How do you protect yourselves? And then we work closely with the infection prevention teams at all of the facilities too. So 100% appropriate if that is their first call. And then they can reach out to us to be able to work through it.
The last question, Lindsay asked a version of this, but it's still, I think, a real question because it's about attitude rather than incidents.
Yeah. So, Lindsay, what's your sense of the feeling among both medical providers and the general public in Indiana? Is avian flu something that they're thinking about? Or now that the flu season's coming to an end, has this ceased to be a topic of conversation?
I do think the conversation has reduced around it because the end of flu season. I think because we're seeing a reduction in some of those wild birds being sick, those migratory birds. So yeah, I do. And other things have come up since then that have redirected people's attention. And, too, anytime something's new, there's a lot of conversation about it. But then when you reassure the public, we got it, we're on top of it, here's the information you need, right? It's in the absence of information that people get worried and excited and don't know what's going on. And so we really try to stay on top of that, be transparent about exactly what is happening, get that information out there to the public, and then make sure that they have the tools to be able to do what they need. And then in my experience, that helps kind of settle the conversation. Okay, we know what this is, we know what to do, we know where to go, both on the clinician side and also on the public side.
Lindsay, here's a very tough question for you, and the answer may be nothing, but is there anything from a public health standpoint that keeps you up at night these days?
Yes, of course. There's a lot of things that come up that keep me up at night for public health. I am really excited about this renewed focus on the basics, on nutrition and physical activity, and how do we get people to be healthy so that they can remain healthy throughout their lives, and an acknowledgement that education is a part of that. How are we educating our kids and young families so that they have the best tools to be healthy? And I want to be a part of that, and I want to be as successful at that for Indiana. So I'm constantly thinking about that. Also, as everybody in public health knows, you never know what is around the corner. So are we well prepared for that and what that looks like? There were so many great lessons learned over the last 5 years. I would hate for us to not capitalize on those lessons learned. And, in some instances, we 100% have, right? We acknowledge, we recognize where we could have done things differently, where there were barriers, et cetera. But I also see some things kind of slipping back to where they were before. And one of those is communications with our clinicians in our hospitals, right? We had really, really great connections. And I think people kind of just go back to their job, which is great. And we want them to, but I still want to be able to have that ability to connect with them if there is something on the horizon, or if there is an opportunity to provide some education and some input. So yes, this is you stay up and you can't sleep every night job. I thought maybe I'm doing it wrong. I don't know.
Lindsay, as we all know, fall leads to a surge in respiratory viruses. Is there anything we should be doing in preparation to better handle the coming respiratory viral season, both in terms of H5N1 or in terms of just the burden of respiratory viruses? How can we best prepare our communities and our public health infrastructure?
That's a really great question. It's every year It's kind of, what is it, like the definition of insanity, right? And I think as an ER physician, I see this firsthand that come January, February, the hospital systems are overburdened with patients, and especially our emergency departments. And there's a gridlock of the movement of patients to get them to where they need to be. So how do we prepare for this known surge that we get every year and think about how we can approach it in a different way? Of course, there's all the public health measures, right, to prevent severe illness and how to stay healthy during this time and continue to promote those. But also just thinking on the healthcare side, because we do know that harm comes from, well, if you're critically ill, not being able to get to a higher level of care, or having to, stay in the emergency department waiting on a bed upstairs, and it affects, surgery schedules and all these things. There's all these downstream effects. So would love to dig in with our healthcare community and how, as from a population health standpoint, a public health standpoint, a healthcare standpoint, can we start to solve some of these issues? Just again, recognizing that it comes year after year, and there is an opportunity there. I mean, there is something there that I think we can do it differently.
Thank you, Lindsay, for joining us today.
Yeah, thank you.
And as usual, thanks, Eric. Thanks, Lindsay.